So again, welcome to everybody to Family Caregiving Tips and Tools for you and your loved ones. I'm excited to welcome Dr. Jane Strommen. She is a Gerontology Specialist with North Dakota State University Extension, as well as working with South Dakota State University Extension. And she will visit with us for the next almost hour about this topic. Feel free to put questions or comments you have in the chat. There are a few times where Jane has interactive. Please do interact. We will address all questions at the end, just in case it's coming up. With that, again, welcome, Jane, and I'll turn it over to you.
Thanks so much, Sam. It's really great to be with all of you today, and welcome to this topic of family caregiving. And this is an area that is definitely an area I'm very passionate about, and lots of information to share with you. And so let's jump in and get started. Thank you for your responses in chat. It's so interesting to see what a variety of responses, you know, from positive to very stressful. Some people are sandwich caregivers, talking about the time it takes. People have said stressful but good, difficult but rewarding. And so there are so many complexities that come with caregiving that it'll be good to kind of talk through some of these things together. So with that, let's get started. You know, during our time together, I'm gonna kind of go over some of the big issues related to caregiving, especially caregiving for older adults, talk about those common stressors for family caregivers. We're going to talk about the stress categories and specific strategies to cope with some of the stresses. And we're going to learn about some resources that are available to help family caregivers in their journey. So just going to start with, you know, who are caregivers? You may or may not identify yourself as a caregiver. You know, for example, spouses often take care of their husband or wife, and they do it just because of their spouse, right? They don't consider themselves a caregiver. So who is a caregiver? Here are some examples to consider. Many adult children gradually start helping their aging parents, and they don't think of themselves as caregivers. Parents of children with special health or behavioral needs don't see themselves as caregivers either. Grandparents who are raising their grandchildren see themselves as only grandparents loving their grandkids. And spouses and family members of military members who come back from war wounded and need care, they don't see themselves as caregivers. Family caregivers living at a distance, those long distance caregivers, they're still helping, but they don't see themselves as caregivers. And children and teens are also providing caregiving to sick siblings, parents, grandparents, aging relatives. And many caregivers are older people that are caring for older adults. And those caregivers themselves are in poor or fair health. So you can see caregivers are very diverse, and caregiving is an activity that occurs across so many different settings, but they're all caregivers, whether they recognize it themselves or not. So some of you said you're not a caregiver yet, or you maybe are just starting down that journey. So just going to pose the question, are you a caregiver? And you are a caregiver if you're doing things like offering emotional support and social companionship. Maybe you're providing transportation to appointments. You're helping to bathe or dress somebody who's frail or has some chronic illness. Maybe you're taking care of household chores, such as meals, paying bills for somebody who can't do those things for themselves. If you are a new caregiver, I'm hoping this webinar will help you understand your new challenges before you. And if you've been in the caregiving situation for a while, I hope this webinar will help you look at your responsibilities in a new way. Rosalind Carter, former First Lady of the United States, made this very insightful statement that I just love. There are only 4 kinds of people in the world: those who have been caregivers, those who are caregivers, those who will be caregivers, and those who will need caregivers. So to get started, I thought it'd be kind of interesting just to examine what we know as a group here about family caregiving. I just have 3 statements about family caregivers that I want you to think about and determine if the statement is true or false. So the first statement is, the most common care decision that families need to make about care for aging adults is about what type of care facility in which to have them live. What do you think that is? True or false? Yeah, please just type it into the chat. I won't take a lot of minutes to do this. Got quite a few falses coming in. We've got a really smart group here. Yeah, great. There's so many people that are saying false, and you know, it is false. The myth is that the majority of older adults who need care will spend at least some time in a nursing home at some point in their life. But the reality is that most care provided to older adults is done by family caregivers in a home setting. Did you know family caregivers provide 70 to 80% of all the community-based care needed by older adults? That's a lot. 70 to 80% of all the care needed by older adults is provided by family caregivers. So the most common care decision is who will provide family-based care when it's needed. So I think that's something for us all to think about. That is the most common care decision, is who will provide family-based care when it's needed. So here's another statement. Adult daughters are the most common primary caregivers when family care is needed to an aging or needy adult. What do you think that is? Just type that into true, false. Quite a few truths coming in. That seems to be a common theme. Let's take a look at this. That the answer is false. You know, the myth is that daughters are usually the primary caregiver for adult who needs care, but the reality is the most common primary caregivers are first the spouses, either husbands or wives, followed by daughters and daughters-in-law. So daughter-in-laws provide a great deal of care, but aging spouses to be in this circumstance is even more common. So it is that spouse that is that primary common caregiver. So here's our last statement. The feelings of obligation that an adult child feels toward a parent are the strongest predictor of how often an adult child has contact with a parent. That's kind of a heavy question. What do you think, true or false? The feelings of obligation that an adult child feels toward a parent are the strongest predictor of how often an adult child has contact with a parent. Getting kind of a mix of true and false there. Okay, I think we've got about half and half for the people who have responded in chat. Well, the theme is false on these questions. This is also false. You know, that there's a myth that there's, you know, that sense of obligation or duty toward a parent is the strongest motivator and predictor about how often that adult child will have contact with a parent. But the reality is the biggest factor in regular contact between adult children and parents is proximity, how close they live to their parent. The second most important factor is the feelings of the parent-child closeness that exists. And then the third factor is feelings of obligation. So thank you all for participating in that, those questions, just to get a sense of what we know about family caregiving. So I'm just going to start off, just talking about what is family caregiving. It's kind of a term that, could be perceived differently. Each of us is aging. Doesn't matter what age we are, right? We're all aging, and we have people that we love and care about that are also aging, growing older, and they may have some care or health needs in the future. They could include, when we talk about family caregiving, it could be our parents, it could be our siblings, it could be children, spouses, in-laws, other family members, friends, and neighbors. The common experience is giving care to a family member in need, and that is the term that they use for, is used as family caregiving. So family caregiving really refers to providing help and assistance through basic regular tasks, such as things like personal care, household chores, financial management, the emotional support, and then providing housing and food for a dependent adult or family member. So there's such a wide variety of the caregiving experience. It can go from just checking in on a person occasionally to somebody who is 24 hours, 365 days a week, caring for somebody who has very extensive needs. With caregiving, the caregiving experience can provide positive results for both the caregiver and care receiver, care recipient. I kind of use the terms interchangeably. Sometimes I say family member, loved one. But it's important to recognize and talk about the positive aspects that each party is getting from this caregiving experience. Positive benefits for the caregiver can include things like being able to spend more time with that care recipient. You have an opportunity to form closer relationships, and you have an opportunity to maybe mend some past difficulties or hurts that have happened. And it also provides some personal growth for that caregiver, because there is personal growth that comes from providing such a deeply personal gesture to another family member. And the positive benefits for the care recipient are many as well. They benefit from having somebody providing care that truly cares about them, knows them, can provide care that is very tailored and individualized to their needs and their desires. And they also have that time and opportunity to share this experience with their family member and to grow closer as well. So talking about family caregiving, it's, we need to plan for that. And the best time to plan for the care needs of a family member is before the person needs care, right? Or at least before they need a significant amount of care. When we're in good health and we have time to look ahead, to plan ahead, we typically have more options available to us. We have the time to think and talk about preferences and future decisions. It's not good to wait until a crisis occurs to talk about the important issues of, preferences for future care, where a person will live, and then details about finances. Planning for care, the care needs in later life, is similar to planning for retirement. The earlier, the better. So there are some unique circumstances to consider that may arise and affect caregiving plans. And just a few of them here to talk about. For the caregiver, has the move into caregiving been very sudden because of an event or a healthcare crisis, or has it been gradual over the course of many years as you've been caring for your parents who are aging? What is the type of illness or care need that your loved one has? That can really have great implications for caregiving. An example, caring for somebody with Alzheimer's disease or other brain impairing conditions can be much more challenging and stressful than caring for somebody who has a physical impairment. The type of caregiver. Are you a long distance caregiver that's providing emotional support and trying to arrange things from afar, but you can't be very hands-on? Or are you a working caregiver needing really to balance your job? Maybe you have kids at home of your own and you need to balance all of this with your caregiving role. Where you live is important as well. Are you in a metro area or a very rural area? You know, caregivers in rural settings face some unique challenges. We know that there are fewer formal services available, you know, such as healthcare, access to specialists and many things like that. There are not as many transportation options, and which can provide a lot of difficulties. If you live in parts of the country like Minnesota and North Dakota, weather problems in the winter, and just the geographic distance and kind of isolation if you're living in a rural area are things to think about. And then there are cultural differences too in caregiving. You know, greater diversity means that families bring their own histories, their traditions, their rituals, their preferences to caregiving. You know, many cultures have family expectations about caregiving and the caregiving roles of family members. And so those are all important things to consider. So having talked about that, let's move into some kind of concrete tips for caregivers. You know, the first caregiving tip is really to size up the situation. What do you need to know, and what do you know, and what do you still need to know? You know, it's important to establish a baseline of information that can be helpful in making decisions about the current time and then future care decisions as well. So some things that you can do, you know, maybe the first step is talk to that person who needs the care. Talk to their loved ones, other family members and friends, and really seek to understand. And then, you know, for your own awareness and get their perspective of what's going on. You know, ask questions like, what, if anything, has changed for the care recipient? What specifically is happening that requires attention? And what's happening or needs to happen to meet specific care needs? Those are all important questions to ask. Get important assessments done, whether that's a medical or mental health or a care need assessment, or the proper diagnosis if there has not even been a diagnosis yet. You need to get a clear picture of what's happening. The basic information will give you a realistic awareness of the care situation, and there are many care management professionals and others who can assist in getting these formal assessments done. And then lastly, is educate yourself on the care needs or the illness or related topics. Learn as much as you can about the illness or the situation so that you can understand what's happening. You can't know it all because it's a job that you weren't likely trained for, right? You weren't trained to be a family caregiver, so you can't know it all. But there are resources that are available to give you the knowledge to do the best job that you can, whether that's your local healthcare provider, you know, books, articles, online information. There are different associations, support groups. So lots of ways that you can educate yourself. So another tip, and this one's kind of jam-packed, there's a lot of stuff here, is talk about the big issues. And you know, finances, legal considerations, healthcare, housing, those are the 4 big issues that all of us need to be thinking about as we get older, but especially important when you're considering caregiving. So regarding financial situations, you know, a really important question is what financial resources are available to provide care? You know, that's a very basic question. Do we know that? You know, most people prefer to keep their financial affairs private, and we get that. But for us to best prepare and provide for family members' care, we really need to gain a full understanding of that person's financial situation. What are their financial assets? and their liabilities. So, develop a list. What are their, their assets, their accounts, their income, Social Security, CDs, stocks, bonds, real estate, deeds. Do they have insurance policies and annuities? What about retirement and pension benefits? Do they have any debt from credit cards or their home mortgage and other loans? It's important to really get a sense of where somebody is at and would they be able to pay for care should they need it? And it's also important in this process too, what would care cost? For home and community-based care, facility-based care, doing a little research to know what that costs is really important. For legal considerations, do you have the legal documents in place that will either authorize you or another person to make legal, financial, and healthcare decisions on behalf of somebody else, such as a durable power of attorney or the healthcare directives? Have you looked at your property and is everything deeded correctly should somebody become incapacitated? I think it's important to have the advice from an attorney, maybe an attorney that specializes in elder law, that understands the family caregiving situation about what things can you do now so that you'll be in a good place should you need to, be able to make decisions on somebody else's behalf. Also, there are a lot of legal documents, such as your social security numbers, your birth, marriage, and death certificates, divorce decrees, property settlements, military records, the income tax returns, wills, trust agreements, and burial arrangements that you need to know about. Do they exist? And are they in an accessible location if you need to access them? Some of those documents might be needed at a point in time if you need to apply for programs such as Medicaid. They'll be needed to determine eligibility. Healthcare considerations really, comes down to the type of illness or frailty of your family member is going to determine the type of care required, right? Where that care can be provided or received and how much it will cost. So it's really important to talk to your family member about their wishes, their preferences, and really important too, their expectations for care, and incorporate this into a plan of care. If their expectation is that their family is going to take care of them, it's important for family to know that that's what the expectation is and have a chance to process that. And is that going to be realistic? Housing. Most people want to stay in their own home, right? That's kind of a given. But there can be just a variety of issues that need to be considered for that to happen. How adaptable is your family member's home? Would a family member who became disabled or couldn't negotiate stairs be able to stay in that person's home? Would home modifications be an option? And if so, what would it cost? Is the home safe for that person to stay in? And then, if it's determined really a move is needed or would be needed in the future, where would that be? So these are really all important issues. They're not going to happen in one conversation. It's going to be many conversations. It takes time, especially for older adults. These are big life decisions, and there's a need for time to process and to think about all of these things. So my advice is to start early and take the time to really discuss and research these issues. So here's another tip, is that it's important to form a team that can work together and provide care when care is needed. You know, caring for a family member or a friend, it's a huge responsibility, and it typically requires more than what one person can handle. I think that's really important to understand that. And if we try to handle all the caregiving by ourselves, it can lead to burnout and your own health problems. And we probably all know somebody who's been in a heavy caregiving situation where their own health has suffered because of their caregiving. So forming a supportive network of family, friends, neighbors, coworkers, etc., can be a tremendous help to caring for a family member. One book that I found over the years that has been kind of interesting is called Share the Care. And it really talks about how you identify that network, and then how you develop a plan of care and do some care assessments. But, you know, one of the things, you know, about assessing care needs, you know, is to think about, you know, the care categories and see, does your family member need help with any of these things? In categories such as personal care, do they need help with like bathing, eating, dressing, toileting, grooming? Do they need help with household chores, such as cooking, cleaning, laundry, finances, those types of things? How about healthcare? Do they need help with managing their medication, to going to doctor's appointments and being that advocate and helping them understand what's going on, to other types of healthcare appointments they might have? How about emotional care? Do they need companionship and some meaningful activities to do in their life and conversation? And the last area to consider is supervision. Is that person safe? Do they need some oversight to be safe at home? And maybe if it's a diagnosis of some kind of dementia, well, is there a risk of them wandering? So, you know, once these assessments can be done and you kind of know what care needs your loved one might have, you can develop this plan of care, and know that this plan of care is a work in progress, because your loved one's needs will change over time, right? So once you have this, you know, this assessment done, and you know, okay, this is what my family member needs, start by listing the things that you're capable of, that you have time for, and that you're willing to do. And then next, list those things that you would like or need help with now or in the future. And then the last thing is to list your informal supports, people that could be in your support team that might be able to provide some assistance for some of the tasks that need to be done. So very important not to take on this alone. So the next area that we're going to talk about is managing stress. And we know that there is stress involved in caregiving. You know, when we're providing care directly to a family member or adult who has specific health or personal needs or challenges, it makes a huge impact on one's life. And we know that there are benefits, positive benefits. We just talked about that. But the caregiving can create challenges, and whether that's increased stress, the individual fatigue, or just tired, just not enough time, or financial hardships that's happening. And in addition, you know, caregivers need to learn new things. You know, most adults or individuals have some experience providing care for a young person or a child or an adolescent child. But, you know, how do you go about doing some new things, like taking over paying bills for your mother-in-law who's always paid her own bills for much of her life? Or how do you know how to care for maybe the complex nursing care of an aging sibling? Well, fortunately, there are increasing amount of resources and information that's available to help caregivers reduce their stress and still be able to provide that high quality care that they want to do. So we know that research has shown that caregivers, family caregiving, involves kind of a common set of stressors. And it doesn't matter the situation of the caregiver, their age or their situation, or the care recipient, what kind of diagnosis that they have, that these are common stressors related to family caregiving. And these stressors fall into these 4 areas of physical demands, emotional burden, financial demands, and relationship challenges. So we're going to take a look at each of these areas a little closer. You know, for physical demands, caregiving often involves some basic practical aspects of caregiving, right? You're helping somebody like bathe or dress, or maybe you're helping them transfer from a bed to a wheelchair. When these tasks are performed for a dependent adult, the resulting demands and just the labor can be very challenging and stressful to caregivers. So what can we do about that? You know, some common coping tips might include getting the proper training and education to care for your loved one, especially if there's things that you've never done, if you've never needed to transfer somebody, or maybe provide some kind of a skilled nursing task. You know, get the training and education that you need. Most caregivers receive no training or education to carry out all these tasks that they're required to do. Encourage your family member to participate and be as independent as they can, because that will help them feel better, and it will also help you as well. Seek out equipment or technology that can help make life easier for both you know, the caregiver and the care receiver. And don't forget to ask for help at support team. And last but not least, take care of yourself. We know that caregivers often neglect their own needs because they're busy, right? They're busy caring for somebody else. They'll take care of themselves later, right? Well, a lot of times caregiving is a marathon. It's not a sprint. And so taking the time to take care of yourself before you get sick as a caregiver, and then you really can't provide care for anybody else. Caregiving can also take a financial toll on caregivers and families. You know, some of the financial demands related to caregiving include just the cost of medical and health care and the treatment that's needed. Maybe you need to purchase equipment or hire help. Many times working caregivers will reduce their hours of work or sometimes leave the workforce completely, having a loss of income and a loss of employee benefits as well. And then long-term care needs, you know, if your care receiver requires costly long-term care, that's a big expense that many people are just not prepared to be able to handle themselves. So to try to, you know, reduce some of the stress that comes with that, you know, if possible, you know, plan for the potential costs and discuss the financial needs and plans with family members so you aren't caught by surprise. Like, oh, I didn't know it cost $10,000 per month to live in a long-term care facility, or I didn't know this or that. Talk to professionals who work in the aging area. They are out there. Find out what programs your loved one might be eligible for, and it could help with the cost of some of the care needs. You know, caregiving can be a tiresome experience that also often feels emotionally challenging, especially if it continues for over a long period of time. Emotional demands are the hidden cost of caregiving, and they may be the most severe in their stress impact. I think that's important for people to understand. They're the hidden cost of caregiving. These are some of the emotions that are quite common for caregivers. Listen to this list: fear, sadness, anxiety, guilt, regret, frustration, depression, and even anger. These are some big emotions, and these are very common for caregivers. And I think it's important for caregivers to understand that they're not alone. these are common. We know that from research. And so it's important to understand what are the strategies that we can help to reduce the stress or prevent it before we get to a point where it's causing problems in our life. And I think it's important to realize that, you know, caregivers, it's only them. They have limits, and there's only so much they can do. And so setting limits is really important, as well as asking for help. You can't do it alone. And then getting a break yourself. It's called respite care. You know, respite care is essential for caregivers to have time for themselves and get a break and do something for them and take care of themselves as a person. And then talk to other people, talk to somebody you trust about your experience with caregiving, because as you said, it can be rewarding and challenging at the same time. You know, a support group is a great place that you can connect with other people who are feeling the same way. And often I've heard caregivers say that they just have felt so alone, that nobody else must be going through the same thing that they are. So reach out to others. The last challenge is around relationship challenges. You know, caregiving can really change the normal pattern of a person's life or a person's family life. And sometimes those relationship challenges can be stressful. You know, for example, you might have adult siblings who are disagreeing about their mom or dad's care, or maybe it's an adult child and parent that are in a conflict about the level of care or oversight that's needed. So to really try to prevent some of these challenges that happen, I think the most important thing is to recognize the need to communicate effectively. And we could do a whole webinar on that, but being able to use those I statements and clearly express needs and issues without blaming, and really looking for some resolution. Include that care recipient in the conversation. Sometimes there might be a dementia diagnosis that makes that difficult, but if at all possible, include them and include other family members. And really, during this whole process, try to remember the positive benefits of that you're receiving through going through this caregiving journey as well. So we've touched on the importance of accessing services. And so we're going to take a quick look at this. You know, there are many supports and services in the caregiving process that are there for family caregivers. And it's a range from, you know, very personal things to the formal and state associations. And I would just say that, you know, this is a very important aspect of managing life for family caregivers, is accessing useful resources that can provide knowledge, skills, and assistance. So, you know, a major source of support in that whole caregiving process comes from informal support sources. And that could be family members, friends, neighbors, faith communities, and others. Often these individuals are more than willing to help, but they're not aware of what's needed, or they don't know how to be helpful. And it's important for family caregivers to be their own best advocate. You know, avoid withdrawing from your informal support network, because this will lead to a sense of isolation and discouragement. So identify those people in your informal support network that could be approached with a very specific request for support in the caregiving process. You know, reluctance in asking for and accepting help is a major barrier in getting the necessary respite and support that caregivers need to take care of themselves. So formal supports are designed to assist caregivers and these services are available in community settings. You know, community resources, you're familiar with things like home delivered meals, transportation, maybe if you're needing a wheelchair transport, adult daycare facilities. There's other support services in the community, whether it's in-home care, maybe it's a personal care worker to provide some bathing or dressing, those types of things. Respite care can be in your home or it can be in a facility. Care management, somebody that can really help coordinate those care needs and access services in the community, and support groups. And there are caregiving support groups and there are disease-specific support groups, and both of them can be very helpful in connecting to people who are sharing some similar caregiving situations and can provide just a real source of like insight and connection and experience. There are state and professional and national organizations that are helpful. We have a array of state agencies and departments dealing with human services, social services, health, and aging that often have databases and information systems designed to assist caregivers. And I've put one key resource here for you. The Minnesota Senior Linkage Line has a toll-free number, and it is available to all Minnesotan residents and their family members for free information, counseling, and links to services and supports available in your community. There's a website as well. So if you Google Minnesota Senior Linkage Line, you can get to their website. And they have specialists who will answer the phone and find out, assess what needs there are and what resources might be available to you. There are many other resources as well. The VA, the Minnesota Extension Service has great resources too for education for family caregivers. There's national associations that are just specifically for family caregivers. I've listed a couple here. There are professional associations as well that can provide resources and supports to family members dealing with very specific care needs or concerns. So Alzheimer's Association, Parkinson's, ALS, there's a long list of those professional associations. So I would just encourage family caregivers to take the time to learn about what services are out there, to find out information, to access the programs that can aid in that caregiving journey as well. So what can caregivers do to take care of themselves? Learning skills for self-care is very, very important. And regardless of how much care you provide, taking care of yourself is an important ingredient for wellness. There are resources in the state which offer caregivers the opportunity to learn a variety of tools to take care of themselves. And I know you could access through that Minnesota linkage line as well, education and for caregivers themselves. One program that I know available in Minnesota is called the Minnesota or the Powerful Tools for Caregivers program. It's a national evidence-based education program designed to help caregivers take care of themselves. And it's a 6-week class, virtual or in person. And I do know that we offer this in North Dakota. I'm aware that it's also offered in Minnesota as well. It's been a wonderful program. I know the Juniper website or organization, it's a network of community-based organizations that offer evidence-based programs, that they're wellness-based programs on a variety of topics like chronic conditions, preventing falls, staying active, and then programs like this for family caregivers. And you can go to their website and find a class if there's an available class near your location as well. I just think it's so important for caregivers to take care of themselves. So we've covered a lot of issues related to family caregivers. I've kind of whizzed through them quickly, but we've talked about important tips for that planning, as far in advance as you can, and for managing care. Talked about those common stressors for family caregiving and ways to cope. And I hope that the whole area around the emotional stressors was information that you can hear and understand and appreciate, that that's common among all family caregivers. We've talked about, just in a whirlwind, about resources that are available and some self-care for caregivers. So I just have one thing left to share with you. And that is the topic of needing care from others. You know, it's not easy. It's not an easy topic to talk about with other people. People can feel very embarrassed or concerned about if they need care. There might be a sense of loss of personal freedom or dignity, or you know, just a loss of control. You know, it's human nature not to think about ourselves at some point in the future where we might be less than independent and that we will need to rely on somebody else for care. That is just absolutely human nature. And so it's difficult to even think about that, let alone trying to engage somebody else in a conversation. But the one thing that's important is caregiving is about love. I think that's an important thing to think about when you're trying to start these conversations. You know, we could have conversations about, you know, what are the best ways to, you know, what are the best words to say and all that. And that would be another session as well. But I would just say, if you need to have this conversation with a family member, think to yourself that you are starting a conversation about love rather than about needing care. And then just begin that conversation. So start the care conversation early. It can help people understand feelings. You can develop plans. You can make decisions that can be helpful if the need arises. So really take time to think about it and start the conversation in your family if that is something that's needed at this time. So I've done kind of a whirlwind presentation of a topic that is very, very complex and full of different nuances, but I just wanted to leave some time too if there are questions. And maybe with that, should I stop sharing, Sam, and just turn it back to you?
No, if you could keep
Oh,
sharing,
sure.
that would
Yeah.
be great.
Okay.
So there were 3 questions that I saw through the chat that came in already.
Okay.
The first one is, it was right at the beginning talking about it typically is family members, spouses, that kind of stuff. The question was, with the current generation style, do you think that will change of who's providing caregiving?
You know, that's in, I think there will be some dynamics that are going to influence family caregiving. You know, we say spouses or partners are that first primary caregiver. We have so many people who are aging alone. They don't have anyone. So yes, I do think there will be some things that change. And I think that we will rely a little bit more on that informal support team.
Mhm.
If we don't have a partner, if we don't have a spouse, if we, you know, people are living, you know, all across and spread out across the country. And so we will maybe have to find and make our informal support team to be able to
Mhm.
provide care. That's how I feel like that we might see some changes in the future.
Okay. Our next question is, we talked about, you know, it being spouses and siblings or in-laws who are the primary caregivers, but what if you have siblings that are not interested in helping with care? Do you have any ideas of how to work with that situation or get them involved to help with care?
That is such a good question. If there's a situation that comes up in families, I think it's around siblings, and you know, one will step up and be that primary person who kind of organizes and gets care going, and the other siblings might just be on the wayside. Either they don't want to be involved, they think it's handled. That it's hard to, you can't control other people, right? You know, and I always start from a place, our, is there a way that those other siblings could contribute? You know, if there's a list of all of these things that mom or dad need, and boy, I'm the primary caregiver, I'm doing all of these things, but you know, these things that on this list, I could use help with. Maybe having that family meeting, if they would be willing to do that. I think having a family meeting and talking about this and talking about like all of those big issues is important. And to communicate your feelings and your needs, but doing it in, you know, I need, you know, I'm providing care for mom and dad, and they have all of these needs, and I need help. You know, and so that's at least a place to start. It's maybe not the end answer.
Okay. And then our the other question I have is addressing general stressors is very helpful. And, you know, there's only so much we can do in an hour. But the person was asking, like, what about huge stressors? So they gave 2 examples. What about the dynamic of caring for a parent who didn't care for the child in their childhood? And how does one care for a sexually abusive parent or an emotionally abusive parent?
Wow, those are heavy questions. You know, I would, you know, and I'm not the expert on everything in of caregiving, but I there are so many emotions. We just talked about that I would visit with somebody. Actually, I would visit with a counselor or somebody that could help work through some of these issues. It's challenging because you're giving of yourself. It's challenging on a good day, in a good situation where you don't have all of these big issues that you're dealing with. And so I wish I had better advice for that, but I guess you have to look at, you know, a caregiver has to look at themselves and what are they able to do? And is it beyond what they're able to do too? You know, everybody does have some limits, and you can't put your life at hold or jeopardize your own health and well-being for the health and well-being of somebody else, right? And maybe there needs to be another approach to for those parents getting the care that they need, if it is too risky for that person to do it themselves.
Thanks, Jane. I just want to remind everybody that we will be sending out an email in the next couple of days with a package of resources. Jane mentioned a few of them, but this package has, or the packet has a few more in them, as well as a copy of the slides to share. Somebody did ask about a recording. We are recording this and we'll send that out, but that'll take a few more time. We need to make sure it's accessible and all that kind of stuff. So that'll probably be in 30 days or so. That recording will come out at the end of it. Jane, if you would go ahead and move the slides. I realized I didn't say, I'm Sam Roth. I work with the University of Minnesota Extension in family capability, or what do I work in? Family resiliency is what I work in. And we do offer U of M well-being points as well as a certificate of participation. And so the next slide shows how to request those points or to request a certificate. And you do that by being able to fill out the survey. And Jane, if you would move to the next one. The survey is this z.umn.edu/later life 2022, and then you'll just want to put in the caregiving webinar as which webinar you've attended. If you've attended other webinars in this series, you'll have options for that, and it'll look very similar. And again, we'll do the follow-up evaluation in approximately 30 days that will include that playlist of recorded webinars. If you have ideas for other webinars you're interested in, we're so thankful for Jane to coming in from NDSU, SDSU Extension to present this topic, because it's an area we don't have the expertise like Jane. So feel free to put those, ideas that you have for that. And we do have more webinars coming up. And if Jane, you just want to scroll through the next ones, we offer talks in Spanish, and these will all be included in the follow-up email, as well as the next one are finding balance and later life decision making, which this one was a part of as well. Then No Place Like Home deals with housing and home issues, and then recovery and health, mainly focusing on opioid use and harm reduction and that kind of stuff. And is there another one, Jane? Yes, and what's for dinner. So obviously cooking, diabetes awareness, nutrition, that kind of stuff. And again, this will all be shared in your email that is being followed up. Jane and I will hang out for a bit more to answer the few other questions that I did see come in. But we do invite you to, like I said, to engage with us on social media. You'll be informed of the next webinars. If you have topics you'd like to be seen presented, feel free to reach out to that. No problem, Mia. And so that's really the end of this. Jane, the question that just came in is that, or maybe it's not a question, it was just a comment. So personal experience, family relationship issues from past and present. It is important to have support from a counselor, even EAP. So employee assistance program, if you're a U of M employee, we do have that to work through those issues as well as to improve those boundaries. So thank you, Teresa, for that reminder as well.
Absolutely. That is a great suggestion about the EAP and those that have that available to them.
All right. And again, if you have questions, please put them into the chat. But we, again, thank you for joining us for this really full hour of information that Jane was able to provide us.